Health says almost 9 out of 10 Washington students are fully immunized. As of last November, 86% of kindergartners had all the required vaccinations to start school. And that number hasn't changed much from previous years. Of the kids who weren't up to date, about a third had an exemption for medical, personal, or religious reasons. The rest were just out of compliance. Washington offers free immunizations for minors through its childhood vaccine program. And now that its kids are back in school, one illness that we don't want to see again is the measles.
Yeah, no question. So Marni Hughes is here in this week's Healthy Living.
Well, all this year, you have been hearing a lot about a measles outbreak. We've seen a lot of cases over the last few months. In fact, the CDC says we've seen 10 new cases recently. That brings the total number of cases in 38 states to just under 1,100 cases, and we've had 85 cases of the measles in Washington. So there's a lot of information out there. We want to make sure that you have what's most important. So Dr. Drew Oliveira is here with Regence BlueShield. Thanks for being here, as always.
Of course.
What is most important for people to know and understand about the measles?
Well, measles itself is rarely fatal, but it's highly contagious. And if you're not immunized, your chance of getting measles from someone who's infected is over 90%. It presents with a high fever, runny nose, a little bit of a cough, and then about 4 or 5 days later, you'll get this rip-roaring rash. You're also highly contagious, not only during the time that you have a fever, but another 4 days after that rash starts.
And you say it's important that we understand the history of the measles and know how we got here.
Well, before the vaccine, measles were really common. Every school-age child essentially developed measles at some point in their life. There'd be 3 to 4 million cases in the U.S. every year of measles. A lot of those folks would end up being hospitalized because you would get pneumonia and or an infection of the brain or an inflammation of the brain.
Mm-hmm. So I think the follow-up question to that is, how is it that we're all of a sudden having this major outbreak, not just in Washington, but nationwide?
Well, if you're immunized, the odds of getting the measles is very low, 97% effective. And actually in year 2000, there were no cases of measles at all. So it was essentially eradicated. And over time, people have not been vaccinating their children as much. That means that there's more people vulnerable to getting the measles, and that's why we've started to see these outbreaks recently in the last few years.
So your message, and really the message of most healthcare providers, is to vaccinate.
Absolutely.
And why is that so key?
Well, if you get vaccinated, not only do you protect yourself or your child, but you also protect the others around you. So people who are unable to be vaccinated, newborn babies, someone who's undergoing chemotherapy, maybe it's a child with leukemia, someone who's immunocompromised. All those people could get the measles from, a case that you might have because you didn't vaccinate yourself.
Mm-hmm. And one thing about the vaccines that we often hear is, if you don't know if you've been vaccinated, is it okay to get vaccinated again?
Absolutely. You can look at your records. You may not find your records. Your doc may not have them. There's no harm in getting one more vaccine.
Okay, Dr. Oliveira, thank you for this important information. And for all of you at home, it's important to note that Washington is one of 3 states that passed new laws this year. Parents are no longer able to opt out of the vaccine for personal reasons. So all kids starting school this fall have to be vaccinated, and that includes preschool and K through 12. If you would like to see more of our Healthy Living segments, you can go to Q13fox.com/healthyliving.
Well, the man who helped